Hi, so my name is Brittany, nurse practitioner and trainer at the Aesthetic Mentor, and I wanted to explain a little bit about how to transition from taking the courses, whether that's the intro courses, the practice clinics, or more advanced courses, all the way to you're now alone in the room with the patient and you don't have an instructor by your side or whispering in your ear or kind of double checking and confirming what you think you should do. This is a very important step because, of course, all of these trainings are supposed to build you up and help you feel comfortable in a new career. So how do you control the consultation while feeling like, oh my gosh, should I be doing this alone yet? All I've done is the trainings with a trainer right next to me. So you control the conversation and you give the patient all of the facts that you learned in the intro course, like how does Botox work? Give them the science behind it. Give them the science behind, I can only treat your frontalis if I've also treated your glabella because I want to avoid an adverse outcome and I want you to be happy. Patients automatically think, wow, she or he really knows what they're talking about. They're getting into the science with me and they're already caring enough about me to nip a bad result in the butt right then and there, telling me why they won't do certain things. So it's important that you remember you took a course that gave you the background of not only the anatomy, but the mechanism of action of all of these products, and then also the support on seeing many different anatomical presentations with models. So you do have a sense of what you're doing, but I know it can feel a little bit like imposter syndrome when you're sitting there and somebody is expecting you to have all these years of experience. So give them what they're looking for, which is comfort and trust in the fact that you're going to provide them with a safe, effective, and beautiful treatment, and also that you're going to be there for them if maybe an outcome doesn't go as you'd planned. So the best way to do that is just stick to the training and give them all of the facts that you learned in the video, because you do know what you're talking about and you are very supported with all of the network behind you if you don't necessarily feel that way up front. So don't get yourself down, don't get yourself all in your head when you're thinking, oh my gosh, I'm alone and this patient is expecting big things from me. You just go back to the basics, explain to them what the intro course has taught you, and explain to them that you want to be conservative for them because that's the truth and that's how you're both going to feel comfortable. Because as you're talking and as they're like, oh wow, you're explaining all these things to me and you're taking the time, you're going to also think to yourself, oh, I do know what I'm talking about. Look at me. I'm going through all these different facts and different products and telling them how I can help them get an outcome and why I'm not going to do certain things that is going to now avoid them from getting a bad outcome. But many more to come with little tidbits like this. A lot of us trainers are going to jump on here and give little pearls that we've seen over time to hopefully help you guys feel comfortable jumping into this career, because it is such a beautiful, beautiful place to be as a hobby and a nurse. It's a great combination. Thank you so much for watching. Subscribe to our YouTube channel, follow the Aesthetic Mentor on Instagram, and you can see the link below if you're a nurse or a provider who's looking to get started in taking these courses.